Hurricane Dorian is now just off the North Carolina coast, where heavy rains and flooding have left more than 100,000 without power. By this morning, Dorian had been downgraded to a Category 1 hurricane, but still threatens coastal residents with storm surges. For more, we go to the Bahamas, where we're joined by Susan Mangicaro, the Senior Advisor for Emergency Response at the International Medical Corps, a nonprofit group of volunteer doctors who deliver emergency health and other services. Susan Mangicaro, welcome to Democracy Now! You're on Nassau right now, not one of the hardest hit islands, but explain what is happening in the Bahamas at this point. Number dead 30, though the number is expected to soar with hundreds to thousands missing.
Sure. Thank you for having me. And we're here on Nassau, and we arrived yesterday along with multiple other emergency medical teams, and we're here to provide help for the government of Bahamas in life-saving, basically, health and medical interventions. So we have a 5-person assessment team right now, and we're working under the direction of the government of Bahamas, kind of in coordination with other local and international humanitarian groups to determine where the greatest gaps are and where the greatest needs are.
So what do you understand as you arrived in the Bahamas of the extent of the damage?
It's been devastating for the islands. Initially during a disaster such as one of this nature, it is chaotic, as you can imagine. Their first goal is to get out there and determine what the situation is. So with the islands, some of them being wiped out completely or nearly, it's been difficult for search and rescue teams to get out there. It's been difficult to get out and do the assessments and determine what the situation is in every island. In the meantime, at the same time, you have multiple emergency medical teams on the ground here getting ready to go to wherever we're needed. And so right now, the assessments are happening. Search and rescue is continuing. It's been challenging, extremely challenging to get to some of the islands with the loss of the airports, the waterways, and the challenges that are faced to getting there. So right now, we're in that phase of getting everything here ready to go so that we can mobilize as soon as we're giving direction from the government.
You're working with specialists in waterborne diseases. Can you explain what is happening around that, what you are most fearful of and what you are trying to deal with?
Sure. After the initial kind of crisis and the trauma care, then in an incident such as we have here with lots of standing water with the heat and humidity, it is not uncommon at all to very shortly thereafter see waterborne illnesses. As a result, what we're doing as a medical emergency medical team is to be sure that we have the supplies that are necessary to treat those illnesses once that does occur, or if it does occur. Things like having proper oral hydration, IV solutions, medications, antibiotics, all of the medicines that are needed in order to take care if a waterborne illness should erupt.
And if people are looking for help, where do they go?
Yeah, this is a tough one. On each island, the government is trying to coordinate search and rescue and sites for the locals to go to. We're also going to very shortly be deployed to one of the greatest impacted areas. So they will be instructed, and word of mouth, as well as people on feet, go house to house for search and rescue and provide the information where medical care will be available, such as when we set up a clinic and other emergency medical teams do as well.
I mean, you have the physical and then the terrible emotional trauma, even for survivors. How do first responders deal with this disaster? How do you make people feel safe?
Sure. We're trained in this. This is what we do. We provide emergency medical care across the globe. So we have training ourselves on how to handle, the crisis, the mental health and psychosocial health issue. That's one of our strengths. We actually will bring on board a mental health, a psychosocial expert, so they can help not only deal with the folks that are suffering, all of the victims of this horrible disaster, but the staff as well. So that's how we're dealing with it, and most others.
Any last words you want to share as you go out to help people? How many other groups are on the ground? Are other governments helping? What is the United States government doing? And what is the Bahamian government, so under siege right now, saying they need? Especially with the airports. I mean, you've got the airport in Grand Bahama that was completely destroyed. You've got another airport underwater.
Yeah, it is a challenge. So the Bahamian government is asking that we work through them in a coordinated effort. The last thing that's needed is when you have multiple people showing up is utilizing resources that are already constrained. So that's first and foremost. Secondarily, the U.S. government, I've seen search and rescue teams from Virginia, from California on the ground, multiple emergency medical teams such as our organization and several others on the ground. So coordinating those efforts and being sure that we're going to the most impacted area, taking care of the most vulnerable and preventing further kind of loss of life and suffering.
I want to thank you so much, Susan Mangicaro, Senior Advisor for Emergency Response at the International Medical Corps, the nonprofit group of volunteer doctors and nurses who deliver emergency health care and other services, joining us from Nassau in the Bahamas. This is Democracy Now!